Have you ever heard of Ibogaine or the Iboga plant? Now, I had initially come across this about a little over a year ago, and I first heard about it on the Joe Rogan podcast. And I thought to myself, I would love to find somebody that knows something about this that could talk about it. And so I went looking, and I didn't just find one person, but I found two people. Patrick and Michelle Fishley, here out of Alberta, but originally from BC, that actually were running Ibogaine clinics in Vancouver for addicts, for people with extreme PTSD, different head trauma, etc., successfully since 2012. They are co-founders of Soul Reflections. You can find them at Soul Reflections Iboga on Instagram, Facebook, and YouTube. But we're going to get right into a conversation with them and hear about some of these potential upsides and downsides of maybe some of the stuff that we have heard about or not heard about yet. Hi, guys. Thanks for joining us on the Activate and Illuminate podcast with Mel. I'm your host, Mel. Together, we're going to be diving into some stories of ordinary people doing a little bit of extraordinary things. People who've maybe pushed their bodies, their mindsets, or maybe society's paradigms. So you're going to find yourself maybe wanting to laugh, cry, or even be inspired. We would invite you to share, like, and subscribe, to sign up for our newsletter as well on activateandilluminate.com. Now, just keep in mind that this information that you are going to hear is informational and educational for entertainment purposes only. This does not constitute professional advice of any kind. The views expressed are those of myself and guests only. Listeners are encouraged to seek professional and legal advice regarding their own situations. So thank you for joining us. We appreciate your time, and thanks again for being here. So you guys, you have been delving into this world of Ibogaine and the Iboga plant. And tell us a little bit about it. Tell us how you got into it, and we'll go from there. Maybe, Patrick, you can start, and then we'll go to Michelle.
Sure. Well, thanks for having us on here.
Yeah.
So it was about, how long ago? I guess about 14 years ago, I ended up coming across an opportunity to take part in a Ibogaine clinic, for this medicine that was to disrupt addictions. And I was like, that sounds really good, because I was an ICU nurse for so many years, and I saw all the flaws in the different parts of Western medicine. So we started working with Ibogaine, and saw such huge potentials and just really wonderful results. And it was just a couple of years into that, I had the opportunity to medically supervise a traditional Iboga ceremony. And as I witnessed that, it was a complete whole package. It offered so much more than just an interruption. It was so much more spiritual, so much more holistically healing as such. So we ended up starting to really work with the full medicine as such. It was with that with that clinic that I was with, doing the Iboga, that we did the movie Dosed, and that was about addictions, but it was so much more. It was about mental health and about everything else about that. And we kept working through that, and really became students of this medicine, going to Africa, doing lots of in-depth training there, a lot of initiation, several, and whatnot.
Yeah.
Mm-hmm.
So now you're a nurse as well, Michelle?
Yeah. LPN for 18 years. And then,
Okay.
so of course, at the time, our kids were younger. And so Patrick would go a lot more often than I did in the beginning. He's also, an ICU nurse. So some of his training is essential for working with this medicine, which is the cardiac component of it. It's a medicine that requires some medical supervision because it does have an effect on the heart, which we can talk about. Yeah. So, and then we just, really our story is the same. Just as he started to work with it more, I started to work with it more, and until it just became now what we do. It's our passion.
So tell us what you do now.
So we have an online community that helps people with preparation and integration. So a lot of what we had found over the years is a lot of the retreat centers, or a lot of the places that either offer Ibogaine or Iboga, don't have very large component, like very large preparation or integration components. And I feel like it's slightly improving, but obviously I think it still needs a lot of work. We also offer retreats. We do have a few retreats a year. Some of them are in Mexico, some of them are here in Alberta. Yeah. What else do we do, hun? Microdosing. We offer.
We have a microdosing program that we are rolling out here. We're starting our first official one. We've been helping people in the past, but we're doing that now. And we're working on, a coaching program and eventually a facilitator program as well for training people because it takes a lot to do this medicine properly. And it's not something someone can just go into very quickly and lightly. One of the things that we find, and it's no fault of people, but people will come to this medicine and they'll have this miraculous intervention or this shift, so to speak, and they'll want to help and they'll want to help others. And I understand that, but it does take a lot of time and a lot of hands-on experience to be able to facilitate in a very safe way. As Michelle was saying, that there is a component of this that affects the heart. Now, the big question is, because there's words around here on the internet that it's cardiotoxic and it's dangerous, but it's not. The actual medicine itself isn't dangerous. Yes, it does have an effect on the heart, but with proper pre-screening, and medical supervision and qualified and experienced practitioners, you're fine. It's no different than being on some other medication that's being watched over carefully by a doctor or a physician of some sort. So it's just a matter of doing things the proper way.
What does it do to the heart?
So what it does, it is called the prolongation of the QT, and that's just the little part on your EKG that is the time that it takes the heart to refill in between beats. And it's an electrical component. And so this just, the effect that it has, it just elongates it a little bit. So on its own, it's fine. And there's parameters we look for in the EKG to make sure that you're coming in a good way. And so by itself, it's fine. But when you have other medications, and it could be like just antiemetics, like in Canada here, like Gravol, or in the States, it's like Zofran, things like that, or Benadryl, which can cause that to be a little bit longer. You mix them together, then it can be even longer. So that's where we run into problems. So just mitigating that and coming in a good way is what we tend to do. And there's also other medications that can increase, serotonin levels in the brain. And so we have to really be careful what they're on with that and make sure there's enough distance that they taper off those. So when you come to this medicine like Iboga or Ibogaine, which is going to already spike that serotonin levels, it's not too much. So we don't get into serotonin syndrome. So it's just really about really good, careful pre-screening, being really having close attention to all the different lab works and the patient clients coming towards us.
How long does it affect the serotonin levels in the body?
Well, we like to get the half-lives aren't that long and all these different things, but we know that it takes about almost 2 weeks to clear like some of these medications out of the system, because they get deep into the system and they can still affect. So, I mean, there's a good chance that after a week, and you're doing this medicine, you might be fine. But this is a medicine of knowing and of truth. And in my, 30 some odd years in ICU and emerge, there's no such thing as, well, it should be okay.
Yeah.
Because you're potentially playing with someone's life and well-being. So we have it cut and dry. It's like 2 weeks. I mean, then we know you're good and you're able to come in a really good way.
So tell us, now you guys started doing this in 2012.
Mm-hmm.
Tell us a little bit about your personal mission and the reason behind this and kind of the profound impact, because what I'm understanding a little bit from your story is just that you're here to help. So tell us how you're impacting with this and the importance of what you're actually doing with this.
Well, I think, both Patrick and I were nurses. So we definitely had that sort of want and desire to work in a field that enabled healing for people. And so I think, after working in that field for a long time, you see the gaps, especially for mental health, but also for chronic diseases. And really, our healthcare system focuses solely on the body, the heart and the liver and the kidneys. And it sort of isolates everything. And there's specialists for all different parts. And there isn't a lot of cohesiveness. And as we started to work with Ibogaine and Iboga, We realized that what that offered was a more holistic sort of approach to health. So when people are in the hospital, we're dealing with the back end of an illness, right? So that illness has progressed to the point where you need medical attention. Whereas when we're working with the medicine, we're dealing with the front end. So we're hopefully helping people before they get into those kind of crises. There's more holistic sort of mind, body, soul. So when we're working with people, we're taking all those components into consideration. That's why one of the people on our teams is also our team is also a therapist. Like, she's a licensed therapist. So, and we continue to collaborate and work with people to offer as much of a rounded, holistic approach to our health and well-being. So Iboga just has a way of working with us, with our minds, which causes a whole lot of suffering and grief, body and soul.
Mm-hmm.
Yeah.
Yeah. So I just wanted to add to that because just as we work at it from a preventative point of view, a lot of people still come because of a disease process or because of something that's happened, some traumatic event or whatever. Like we're seeing a lot of this talk with, on Joe Rogan and all these things about veterans with, traumatic brain injuries and concussions and things like that, right? PTSD, almost, childhood PTSD, different things like that. So this medicine is really good for getting in. And with the brain itself, it actually repairs the neurons, and the pathways and creates new ones. So it has neurogenesis, right? And that big Stanford study they had done with about 30 or 35 veterans down in the States there. And they found, like after one treatment, just one treatment with this medicine, there was anywhere from a year and a half to 5 years or so of brain regenerative that happened with these people with one sit. So there is definitely a process that is very beneficial of helping people, move past things like that. Not to mention with addiction and things like it helps with that as well. So there's a lot of benefits for this, no matter where you're at. It just has a lot of different things, but definitely it can help. It can help you get to the kind of the core of kind of what's going on, so you can be more preventative in your life moving forward. With this tradition, like we work with this in a traditional way, and the tradition is with the Bwiti, and that's from Gabon, in Africa, right? They've been around for thousands of years, and with this is just really just a study of your life, the study of life. That's what it's all about, and so it's about how do you move forward in your life with everything, and this medicine like this really helps us to get in and really know ourselves in a very truthful way and work within.
So I had understood initially in listening to that podcast with Joe Rogan that, that it was about addictions and about trauma. But when you just talked about concussions, a number of years ago, I had a fairly severe concussion. Tell me what it does. Now, this is just for my own personal interest now. Tell us what it does in physical things like that and how long you're seeing the repair of the neurons and just tell us about that.
So I think it's hard to describe. There's studies being done now, and a lot of the studies, we just attended a conference not that long ago. And, when people are studying, they're usually just studying Ibogaine. So just to clarify, Ibogaine is one alkaloid from the Iboga plant. So
Okay.
that's the difference. Okay. And the Iboga plant has over 100 alkaloids. So they're taking, but the Ibogaine is of the highest concentration in the plant. And it's a really complex alkaloid. So they don't really understand how it fully works. I think one of the researchers there said, we're going to have to use AI to really. So it's a super complex alkaloid and it affects, I think, at least 6 receptors in the brain. So it has a tendency to go in, and when it attaches to those receptors, it tends to heal them and reset them sort of back to like normal or back to like original factory settings, we'll say.
Mm-hmm.
So that's one of the reasons why it works so well for addiction, because it's attaching to the same receptors as opioids do, and it attaches the same receptors that a lot of the dopamine attaches to. So when that happens, what we have in addiction is quite complex in the way it works with dopamine. So dopamine we need for survival. It's what creates an impulse to get up and go look for food or to do something that might be a little bit dangerous, but we need to do it to be able to eat and survive and keep warm, right? If we didn't have dopamine, we'd have no desire to go do those things. But what happens with addiction is it kind of hijacks that system and we get into like a pendulum swing. So as we take our hit of whatever it is, and get that dopamine release, it's like a little too much dopamine, and the body goes, no, that's too much, and puts a process into place to bring us back down, but it goes a little bit too far the other way, right? Doesn't quite come back to center, and that's when people will complain about, withdrawals. That's where withdrawal happens, and they continue to go on this like back and forth sort of swing. And Iboga seems to just be able to go in there and just kind of rebalance it in a beautiful way. So it sets you back. So when we have people come for addiction, it's really important for them to know you are now totally drug naive. So your tolerance for your drug, whatever it was, is now back to like zero, what it was like before you started using, because we don't want people to OD, right? So that's one of the things it does in the mind. It's also really helping us look at our trauma in a different way. So when we talk about PTSD and those sorts of things, it allows us to have a little bit of a removed view of that trauma. So we can look at it from maybe a third person, or we can look at it from another angle. If we have childhood trauma, we have like, abusive parents, it maybe gives us a different perspective of that abuse and somehow just allows us to be able to let it go. And sometimes there are things that you can just tell people, you can just say, like, how you can just like give advice and it just never clicks. But when they hear it in the medicine space, when it's there and they get that message, usually like really simple, maybe 3 or 4 words, it just clicks and they just get it. And they're just like, I get it now. And they can just let that go. It's not that the trauma gets forgotten. It's that we just have another perspective and view of it, and it doesn't run our life the way it was before.
This episode brought to you by protandemcanada.lifevantage.com. What if you could turn on your body to work like it was supposed to? What if you could have it remember how to handle toxins, stress, and the environment like it used to when you were young? What if it worked for your pets too? What if this is not about supplementing something that is missing, but activating something that has gone dormant? About actually turning on your body to make these things again. Learn how to activate your body now. Check us out, protandemcanada.lifevantage.com.
It softens the emotional attachment
Okay.
to everything.
So how would you relate it? And I don't know if you can, but some of these other things that people are doing now, like for example, MDMA as therapeutic, or mushrooms are as therapeutic. How do you relate it? In the space of all that, how do you compare it, or do you?
Well, on one hand, I mean, they all kind of fall under the umbrella of psychedelics, right? A lot of these other medicines contain DMT, and so that's something totally different than what Iboga is. So Iboga isn't a true hallucinogenic like the other ones are. This is a neurogenic, so it's like walking in the dream or creating in a dreamscape, so to speak. This is kind of like a waking dream. It's a lot different. The one thing that this medicine, Iboga, does is when you're taking it and you're like in the thick of it, when you're in it and you're going through the experience, it demands that you stay present in your body. So at any given time, you can have a discussion with somebody as if you weren't even taking any medicine, right? But at the same time, you can go inwards and have these experiences that are quite able to shift your paradigm to make a difference in your personal outcome following that. The other medicines, they're great. They all have a reason. They all have a purpose. I think they can all work together when done at the right time and right intervals and for the right reasons, right? Setting and dose. And definitely this medicine here, Iboga, is one that really needs to have a lot of space around because it is such a big medicine and it does take a lot to process. The integration component of it, it can take anywhere up to a year to integrate some of this stuff, I mean, ayahuasca is another really big one too, where it can take a long time to integrate. So it's just giving enough respect with that, respect for these medicines and respect for ourselves. Like, could you imagine being in a conference center and you've got an instructor coming up and He's talking about a whole bunch of things. And then as soon as he sits down, this other instructor comes up and starts talking about a whole bunch of different things. Now they say, okay, so remember it all now. It gets too
Yeah.
much. So you need to
Yeah.
have space to integrate it, to learn it, and then to move to the next experience. So they're all really, really good, but they all have different things that they do, and just need different times to do them at.
So, from your guys' experience, what do you think addiction is really rooted in?
Well, addiction really is, when we have addiction, we're trying to find the solution. We're trying to find like what we need to cope. It's initially starts as a tool and seems to work really well, of course, until it doesn't,
Yeah.
until it starts, wreaking havoc on your life. So, addiction is a reach for medicine, we'll often say, of some kind. So, or it's a lack of a coping mechanism. It's a lack of your ability to soothe yourself or to create a space that feels safe. And so we often think of addiction just solely as to a substance or, some of the more extreme behaviors like gambling and that kind of thing. Addiction, we all have addiction. I would say most of us have a very mild addiction to, yeah. So, it's there in our everyday lives. It's also really profound in the way we view the world. So if you think about like, somebody's really judgmental, it's almost like, they have an addiction to that judgment. They get a reward, right? So really what you're doing is you're doing a behavior or taking a substance, you get a reward for it, which gives you the dopamine hit, which makes you feel better in that moment. And then, and then, of course, it moves into the withdrawal, right? The irritability, the lack of sleep, the, unable to focus and concentrate. So, and then you swing back into it again. And I wonder sometimes too, with all our cell phone use and everything, and sort of like such what feels like an increase in ADHD and social anxiety and all those things, if they're not more of just withdrawals and we don't really understand them because we don't see an obvious addiction. But with a world that's so easily distracted and we don't spend a lot of time with ourselves. So Iboga is really good at teaching us how to be with us. It teaches us our mind. It teaches us what we're doing that's like sort of negatively impacting our lives so that we can make the choice if we want to continue with that or not. So Iboga never take their choice away, which can be hard for people when they come and they have an addiction and they just want the medicine to like take it away. They're just like, I just want to come and then not have this addiction anymore and be fixed. Well, that takes your participation. Like you have to make the choice, but the medicine helps you see why maybe you're making that choice in the first place, which maybe you don't understand, and what you can do or how to fix it. So, so it teaches us us. It's really amazing that way.
Is that what they talk about when they say it's the interruption of the addiction versus the cure of the addiction?
Yeah. Yeah. It's an interruption. It doesn't cure it. It just
Yeah.
interrupts. It stops. Like for substance, it stops that. It can stop that initial withdrawal part of it. Right. But I mean, under everything, addiction of the mind is the biggest addiction that we all suffer from.
Yeah.
That perpetuates everything, whether it's negative self-talk or it's addiction to more or becoming an addiction to more, this search for more, the search for this endless search for relief for something. And we don't know how to make sense of things. As Michelle was saying, Iboga really works with the mind, and then it can actually help to quiet the mind. It can quiet the mind to the state of, like some monks who take years of meditation to get to a quietness. And we see people coming in who have such fast, chaotic minds. One thing you notice is like, wow, it is so quiet. Like I haven't got any thoughts at all. And usually they're racing. This medicine works kind of like that Windows 98 program when you defrag your computer. You have that big colorful screen. It was just all over the place. It looked like so busy. And then you push the button, it defrags it. So it was, got so much space left. And that's what this medicine does. It helps clean up the space, giving us room to be able to think. and feel a little more safer within ourselves that way. Yeah.
So, just in a little bit of research online about this, I've been able to see other things that it's been helping for as far as physical symptoms or physical conditions. Tell us about that and what you've experienced and what your perception of that is.
Well, I think we all know that the body can heal. And
Yeah.
so in a lot of in ways with or without medicine, I mean, we can heal. So it's tapping into that and we can never guarantee with anybody what the medicine will do with them. So that's the hard part with medicine work is this is a spirit we're talking about and it's going to work with you in a way that you need right now in this moment. And so sometimes what we think we want or need is not necessarily what we need to deal with first. It may come after, but initially we may need to deal with some other things first. So really it can help the body because it helps with inflammation for one. So a lot of chronic pain, a lot of inflammatory, anything that causes an inflammation process, a lot of times people feel better after. It's also impacts our nervous system. So it can be really helpful for anything that's attached to our nervous system, which is most things. It's really good for the gut, especially when we take it in its natural form, like as Iboga. It's literally the bark of the root. And so you're taking this really fibrous material that the gut loves. So it can be
Mhm.
really good for the gut, antibacterial, antiviral, antifungal. So it can do a lot of things and we never claim it's going to do anything and we never claim it's not going to do something because we just don't know. And I think too, we have to remember that physical stuff is not just physical stuff. Sometimes physical stuff is mental stuff. Sometimes physical stuff is spiritual stuff. And so where you are in that process is unique for everybody. And so the medicine
Yeah.
is to work with you in that moment. And it does it for everybody different. It's a hard question to answer in a way.
Yeah, I mean, one of the most difficult things I see over all these years is when people come to this medicine, it's that comparison to others.
Hmm.
Well, this happened to them, this was for them, and I want that too, right? But as Michelle was saying, sometimes it's spiritual stuff or emotional stuff, or some people's journeys are different than others. Some people get relief at an amazing, miraculous type of a shift, and others don't. But what they might get is the ability to become them as much as they need to be to shine through it all and live through it. Because maybe their purpose in life is to help somebody else. There's different reasons why we are all subject to whatever it is that we have, right? It's like with Parkinson's, right? It can help with Parkinson's, and we're finding there's a lot of good relief with that, with symptoms. But at the same time, not everybody is going to get full relief from it because sometimes it's just different reasons why people have these illnesses or the diseases, right? Because there's so many different factors that go with it. But what really counts is in all that, what are you going to do? How are you going to live your life? How are you going to live your life? What are you going to do to make your life count? What are you going to do to make your life joyful? Impact yourself, impact others. That's really, some of the core things that this medicine helps us realize.
So, if you were to share a particular poignant story or person and their journey, would you guys have anyone that comes to mind that you would be able to share their experience of what transpired for them?
Well, we probably have a lot.
I bet.
Why?
I mean, we worked so much with addiction in the beginning. A lot of those people are still doing well, so that's a decade later. Yeah, we have a person that's just, I think what's hard to describe about the medicine is how it shifts your understanding of yourself. And what I mean by that is like, what makes up our identity, what makes up who we are is a lot of the stories we tell ourselves. And a lot of these stories are created when we're young and we replay them and replay them. And the mind just is a beautiful tool. But a lot of people get confused that the mind is who they are and they can't
Mhm.
separate the two. And so I think for me, what I see is the most impactful thing is when people just are able to take a story that they've told themselves for a long time. Either like we can generalize it because so I'm an addict or I'm a bad person or I can't have a good relationship with my mother. and then it just shifts it just like the slightest a bit so that they can see that, that story they've been telling themselves is a lie. It's not true. And that they get to replace that with whatever it is they want to replace it with. And it's realizing that choice, I think, is what is most profound for people, that they didn't realize they had a choice to choose something different.
Yeah, that can be so profound for them. Like we've had people simply say, like, I didn't realize that it didn't have to be hard to work. Life doesn't have to be hard. I mean, that sounds really easy, but when you're stuck in the middle of it and everything seems to be hard, everything seems to have always been that way, then that's the only story and believe me, I'm sure people have told this person many times, no, it doesn't have to be hard, it doesn't have to be hard. But until you know it in here, not just in here, but in here, a real sense of knowing, you're suffer with that. And once you get that knowing, then everything just kind of clicks, and that's the experiences we see that people come with, and they get this sense of real knowingness that allows them to see it through a different set of eyes, like eyes of the observer, just from a different point that's no longer emotionally attached, and it just makes such a big paradigm shift for them. So it creates a real sense of ease in that moment and moving forward if they choose to go that route.
Yeah.
Yeah, because it's all about choice, and we have the choice to slip back into the old routine. With this medicine, they also talk about neuroplasticity following the medicine experience, where you can actually learn new things in a really efficient way and to even a greater understanding of something. Like our teachers in Africa say, if you want to learn something, do it on Iboga, because you're really going to learn it. It's really going to have that neuroplastic effect. But that being said, so for example, let's take an addiction, and let's say I've stopped the addiction and I can start making new habits and new ways of being, and I can get really good at that. So that's really good news. But if I just get lazy and go, well, I feel good, I don't need to worry about it, I can go hang out with Jim and Steve down the corner while they're smoking crack. It's not a big deal because I don't need it anymore. I'm really good. Eventually you're going to start smoking crack again. And the downside is that you can relearn those old things really good too. So the choice we have is, are we going to learn new things? Is even with the way we think about in our own minds, being our own self-critic, our negative self-talk, we can learn to have such positivity within ourselves and really do well at that. Or we can choose to keep talking negatively and do it even more damage. So it's really amazing in that way, but it really requires our full participation, full accountability. This is not a medicine of just a quick spiritual bypass or a quick easy fix. This requires our full participation. And it's, you get your elbows dirty, your knees are dirty, everything is dirty because it's your work, but it's very satisfying and you can make a real difference. Mm-hmm.
Did you guys see, now I don't want to say repercussions, but misperceptions of people's perceptions when, some of the exposure around this in the different documentaries and the different podcasts and stuff? Is there anything that has come through those exposures that you guys felt was maybe needed a little bit more clarity or a little bit more information on, that the public maybe took the wrong perception?
Well, I think a lot of times, especially like with more of the sensational, kind of Joe Rogan kind of podcasts,
Yeah.
and it's not necessarily the fault of the person sharing the information. Is just a lot of times people are excited, they're trying to explain the benefits, and they're trying to, especially right now, there's a lot of work trying to get, especially in the States, because it's a Scheduled 1 in the States, so they're trying to get it out of that umbrella and into the umbrella of like something that's useful, something that has benefit, right? So they're excited about it. They want to share all the positives, but sometimes what that does is oversimplify it, and it creates expectation. And so this is why we have preparation, or one of the big reasons why we have preparation is to help people manage expectation. So we can have asks, we can be like, this is what I feel I need to work on. This is my struggle right now. And the medicine will listen. It's just that it might not answer you in the way you think. And if we get so attached to only one way, because we have to remember, we have a very limited view of our life, So the medicine has that beautiful bird's eye view. And so you might think that the problem is here, but the medicine is trying to show you we can fix this, but you have to look over here. Like, this is the problem. And if you're so determined to only see it that way, or to be so determined that this is the thing you need, and you won't accept like what it's trying to actually show you, you miss it and and then there's disappointment. So that's the big thing that we try to really work with people. Like, what is expectation? What is, setting an intention? We want to be intentional with our life every day. So the medicine also wants us to be intentional with why we're there, but not to be like blind to or so rigid that we can't listen to what's being shown. So I think that's probably the biggest thing that we see when people watch these podcasts or listen to other people's experiences, is they're like, that's what I'm going to have. We're like, no, you're not going to have that at all, because that was that person and you're not them. So why would you
Yeah.
think, you're going to get that? So yeah. So, and especially with visions, people get really off visions.
Because, they hear it's a psychedelic. And when people think of psychedelics, they're really thinking of, medicines that have DMT in it and have these hallucinations, all these fantastic visions and things going on and whatnot. And like I said, this is not hallucinogenic. This is a neurogenic. And so while you can have visions with this, it's not the case for everybody, and every time you do this medicine, it can be totally different. Because every time you do this medicine, in some way you evolved or you slip back, or wherever you are in life, you're coming slightly different every time to medicine. So your experience every time can be different. And that makes for an amazing, amazing medicine, because it's not just a cookie cutter. You're not going to come and just see fancy things in the sky and different things and all these different designs. You're going to see what you need to move forward in your life. Not someone else, but in your life. Yeah.
So there's going to be people listening to this right now that are like,
Mhm.
okay, that's great. They're doing this. Where are they? Where do they do this? How can I do this? How can I access it? Are there other people in Canada doing this? Who's doing this in the world? So maybe tell us a little bit about that. How can people access this and participate with you guys? Now, when I started researching this topic and started looking for someone to talk to on this, you guys were fairly prevalent on that information. So is this something widespread in Canada or in the US? How can people access it?
Well, there are people out there who are doing this. Everyone. I guess for the most part, a lot of people do things a little differently. The biggest thing when someone's looking for this is to do your homework. Go through the questions that you need to find out. What's the qualifications for this person or this facilitator? What's their training? Is there any lineage? Is it traditional or is it just clinical? What's the safety factors? What are they doing to ensure my safety? And do they have plans of action for it? What is their view on being ethical? What are other people saying about them? So many different things, because there are people out there who are doing things like I mentioned before. Someone gets healed from something and they go, I want to go do this. And so off they start. And that in itself is really dangerous. We've had some things that have happened in the news over the last couple of years. There's some tragedies, and they really did not have to happen. They didn't have to happen. They all could have been preventable. This medicine is not going to kill you. It's not the medicine. It's the people who are doing it. You got to make sure that they know what they're doing. And it's also being accountable to yourself, that you're not doing things that you're not supposed to be doing. And that's where the facilitator comes into play. So you need to ask these questions, find out who is doing this in a really good way. Because there are people around who are doing it, but it's like I say, you can Google online and get all kinds of things up here, but it's really, caveat emptor, right? Because there is so many different people just doing things, and not everybody does things in a really good way, or some people will cut corners. But when it comes down to it, we always say, your safety is first. There's no good reason to have this amazing spiritual shift and experience if you're not going to be in your body to appreciate it. Right? We have to make sure that people are coming in a safe way and leaving in a safe way and integrating in a safe way, because this, spreads out over months later, where people can have a real unraveling because things are so different. And if they're by themselves, left to their own devices because they don't know, it can be really dysregulating.
Uh-huh.
when things come up. That's why it's such a big medicine for integration. That's why we've created what we did with this community with preparation and this year-long integration, because it does take a long time. So I would just say, do your research, talk to a few clinics, and and ask those questions, because they should be able to answer these questions if they're doing things in a really good way.
So when you talk about some of those statements, tell us more about your communities, about your retreats, what people can expect, how long they are, where they are. Tell us a little bit about that.
So our community's preparation and integration is online.
Okay.
So that's through a Mighty Networks platform. And, when people reach out to us, we connect with them and get them signed into that. And it works similar to like Facebook, where you can have, conversations, and then you can also have courses, and we can do um, presentations and all that kind of stuff, and just offer a lot of information and support. And then Patrick can tell you, probably our retreats are usually 8 days. There's usually 2 ceremonies in that 8 day. So there's arrival, and then we do ceremony day, and then we have what we call discovery day. So you're still very much with medicine on that day, but it's very introspective, and you're not doing a whole lot. You're kind of chilling and being with yourself. And then we have an integration day where we usually have massage, maybe some breath work, all that kind of stuff. And then we kind of repeat that again. Ceremony, discovery, integration, try to get out to nature, and then people leave. So that's kind of the flow of a retreat. And what else do you have to say, Hen? I think he's better with the reaching out, like our social media.
Yeah, we usually reach out with our social media. We have our Instagram and Facebook, and we're with Soul Reflections Iboga. You can find us like that. We're not really advertising anything, but we're just making public awareness, trying to create curiosity so people can ask questions in a good way. Yeah.
Yeah.
Is there any impediment to sharing this in Canada? Like, is when people say, "Oh, is it legal? Is it this? Is it that?" Tell
Mhm.
tell us, why people don't know about this.
Well, first of all, in Canada, it's kind of a gray area, right? It's neither legal nor illegal. You know,
Okay.
we've never ever had a problem sharing with this. I guess realistically, from point of view, being a nurse, we've always been a patient advocate, a voice for others, and to help others do things in a safe way. So we view this in a lot of ways of doing that as well, helping people do this in a safe way, because people are going to do this. You don't hear a lot about it because it's still fairly new. I mean, it's one of the psychedelics, one of these medicines that it's not talked a lot about. Up until the Joe Rogan stuff, you really didn't hear much about it at all.
Know
Um,
about it.
you hear about ayahuasca, you hear about mushrooms and different things like that, but we never really heard much. And it's one of the things that, oddly enough, when people are in these great big psychedelic conferences, there's not really a lot of people who even talk about or talk on the subject of Iboga or Ibogaine. Now, the one good thing about this whole Americans for Ibogaine is this whole movement is that it is causing a stir. It is causing conversations to come up, which is good, because this medicine is a really amazing medicine, but it also demands a lot of talk about it and a lot of understanding. So in one good sense, it's all this talk is creating education. And so I'm really happy about that. And that's something we knew was needed to happen. And it was probably going to be Ibogaine that did it way back when we did dosed, right? We kind of figured it's going to be Ibogaine that kind of moves this forward, because they can look at the one alkaloid and they can use data on it and everything else like that, where Iboga is like so many. And what they're finding is some of these alkaloids that are in the full medicine of Iboga, a lot of them are buffers, and they work to help with the system, help buffer the heart, help buffer different parts of your system in your body, right? When they're using the medicine. So, as we move forward, we'll see more and more talk, and as people will start
And
to hear more. And
I think we'll see more regulation
Yeah.
as we pull it from. So there, I think we're in like this kind of funny little in between space right now, where
Mhm.
there's a lot of push for regulation, legalization. It is one of those medicines, I think, that has to be in a space that has like rules, so to speak. We need people who have the skill set to be working with trauma. We need
Right.
people who have the skill set to do the medical screening and supervise medically during treatment. like it's more complex than, say, psilocybin, where you can have, and I would even argue psilocybin, ayahuasca. I mean, these medicines are powerful, and they can really open up a person's psyche. And we need to be aware of what we're doing when we're serving these medicines. We have a responsibility to serve them too. And so I'm hoping that we'll see, as we get into more of the clinical side of things, that we can see a balance between the regulation and the clinical side of things. And I think things like addiction, like what we have right now with fentanyl, and there's even new fentanyls coming out that are even worse. Those are dangerous. They're really dangerous. And Iboga, it's getting to the point where even with Iboga, it's not a good mix, even though that it's still technically an opioid. That's where a lot of the trouble, that's where we have deaths, is when people are, a lot of the times, it's with these like benzos that are in the fentanyl or in the opioids or in the heroin. And it's just not as easy anymore to detox people. And people with these addictions need medical detox because these drugs are so crazy now. So that's where you need people who have training to deal with that. You need people who really understand that process and how that works and can support you medically if you need it. And then also we're talking about a person's mental health. And so we need training in that way to offer people support when we're talking about trauma. Even having a conversation about a traumatic event for that person can create another opportunity of more trauma if we don't do it properly, right? So we have a lot of responsibility when we're working in these spaces. And so in that way, I'm happy to see regulation come in. I think we need some baseline skills that we have to say, look, if you want to do this, you need to go get this education, or you need to be certified in this way. So you can work with people. And then the public then has a gauge to say, okay, I want to work with this person because I can see they have all these qualifications. So we don't really have that right now, right? Because it's in this in-between space. But I'm hoping we'll be able to see more of that in the future so that people can safely go to these medicines and they don't have to do it in a way they feel like puts them at risk. And I would say too, if your Iboga retreat is really cheap compared to what you've been searching for other ones, that's usually a red flag, because that usually means they're not paying for like medical people to be there, right? They're limiting their
resources,
qualified staff as much as possible, or not at all, so that they can make that retreat safe, or that, or cheap, but it's not always good to go the cheap route. Definitely can get what you paid for.
That's fantastic advice in anything, I think. Tell us quickly, you mentioned Dosed. You mentioned the documentary Dosed. Tell us a little bit about what your participation was in that.
Well, it was at our clinic, and where this young lady, she came, after trying, to treat depression and things with magic mushrooms and that. And then she had heard about this thing called Ibogaine or Iboga. And so she ended up coming to our clinic, to our retreat center. And I was, person supervising all the medical part of it and help facilitating and such like that. And so just working with her, over the weeks and weeks and weeks to help with that, and she's doing fantastic now. But there was a lot of layers to go through, and everyone is different, right? Everyone has so many layers. One thing that was really amazing with her is that so many people, when they watch it, can see themselves in her, because, she was a paralegal. She was in the space of working, she had parents that loved her, all these different things like that. But yet at the same time, everyone in the back alleys downtown East Hastings knew her. So she was everything, right? She called herself a garbage can junkie. She just, whatever. But it's the perseverance. And she had a lot of perseverance going through it, because there's so many, like I say, so many layers to pull back. It really showed that people can have hope. There is something else other than just giving up. And as that having your full participation and having that hope that you can attain something, that was really big for her. So that's what we did, and it was a really quite an amazing project that we did with her.
And that's on Netflix?
No, it's on like Venmo and I think Apple TV, but on Venmo you can get that. Yeah.
Okay.
Yeah.
So we could talk about this for hours. I know we don't have that time today, but
Yeah.
tell us, is there anything else that you guys would like to share about this topic for right now before we sign off?
Yeah. Well, so even if you feel that you need like this medicine like right away and there's a desperation and you just need it, take your time, please, and do your homework. Find a place that's going to be safe for you. Doesn't matter which place it is, as long as it's going to be safe for you. That's what really matters. This is why we talk a lot about this, is because it matters. You matter. And we want you to get help in a way that's going to be very personal for you and in the long term, really make a difference. So,
Yeah. And I think for me, I think it's just like this medicine and all of these medicines are an opportunity to study ourselves, and that should never end. So to remember that what happens in ceremony, what happens at a retreat is just like the tip of the iceberg. What really matters is what we do with that information that we learn while we're there and how we apply it to our everyday life. It's our everyday, little moments that make up our life more than like that one event that we had at a retreat center or and they offer powerful shifts, but we got to make them our own and decide what we want to do with them. So it's people forget and they get panicked and they think they have to do everything in a retreat, and if they don't get it done there, then it's not going to work. And no, that's not how that works. It's like you have the rest of your life for this to unfold. This is life's purpose. It's just to be there and learn about ourselves, and that's it. That's simple.
Well, I have to tell you that it makes my heart so happy, first of all, to see a couple working together in their passion and their purpose and their mission, but people caring about people, helping them, and still like just providing this. I have no personal experience with it, but what I think is an amazing support for people out there. It just makes me so happy to see you guys working together and what I think is your mission work, because I can feel it in the both of you. And yeah, it blows my mind that you were doing this in Canada in 2012 and we're just hearing about it now. So kudos to you guys. Tell us quick, for anybody, how do we find you again? We're going to have that in the show notes, but I want them to be able to hear it. Tell us quick how they can find you, and then we'll go from there.
Okay. So we're on Facebook and Instagram at Soul Reflections Iboga. You can email us by info@soulreflections.net. And then our website is soulreflections.net.
And YouTube. We have YouTube
and a YouTube channel as well.
that
It
just
has
has
lots of information, lots of interviews, lots of things to learn about. Yeah.
Well, Michelle and Patrick, thank you so much. I so appreciate your time and your willingness to talk about this. And I would encourage anybody who's researching this and wanting to find someone to check you guys out.
Thank you.
Thanks for having us, Mel.
Yeah, you're welcome.